So welcome back to the Active Balance podcast, where we're going to be going into a little bit more depth as to the actual treatment techniques in active balance and some of the history and heritage and where they actually came from, because we went last time into a little bit of where you started in terms of your massage, but then you've quite soon after that learned osteopathy and manipulation techniques. So do you want to just start off with a little bit more background on that?
Yeah, I developed a very busy practice from 1974 to 1980. I was seeing about 100 people a week with a 3-room clinic. Osteopathy really worked for me, but I was always curious, is there other ways? And then I went on a course, a postgraduate chiropractic course called sacro-occipital technique, where they were using 2 little wedge-shaped blocks around the pelvis, depending on the imbalance that they would evaluate first. And it was very gentle realignment. And they said that you need to realign the pelvis as a whole, and that then put the spinal base into position, which it actually did. It was very successful. So it made your spinal work much less invasive. It was just changing what you call the vasomotor response to the organs and the muscles. But also inside of osteopathy, there was a man called Sutherland, who was more famous for his cranial work, had developed a technique of taking a joint and instead of trying to break the fixation with manipulation, actually taking it into exaggeration of the strain, and that would rebalance the joint. So I learnt that method, as well as some other eminent chiropractors, was also osteopaths, forward in that kind of concept. So that showed you that you didn't need force.
Yeah.
And so you were working much more with the body's self-corrective abilities. Then when I learned from Dr. Hatsumi in Japan, he showed me that working through the tissue, you could actually affect a person's neurology if you knew how to squeeze and press on the tissue in the correct way, which he'd learned from his Marshall system, but also incorporate into his healing system. And so that started to put the whole thing into a package. And because of the potency of those kind of techniques, say there's a point here on an energy channel that's really, really good for if you're dizzy, car sick, nauseous, stuff like that. So you could then teach a person to do that at home.
Yeah.
As I mentioned earlier, this point is really good for headaches. There's a point here that's really good for inflammation. So by being able to teach people to press, and even at a low level of them just pressing, we're starting to get results. And as you build this framework up, you can develop a recipe for the person after you've balanced them to show them how to maintain this very, very simply with movement, pressure, and lengthening techniques or pandiculation of the muscles. And that's really the sort of enclosed system of self-help that allows us to maintain the alignment and get rid of pain, inflammation and movement problems.
Would you say, Dennis, when you went from being more of a bone set and clicking mentality to working much more gently but with the whole body, did you see a difference in your client base? Were they returning less often? Were they coming once a month instead of coming weekly? Because you were treating the whole body instead of coming in and potentially treating a knee or a back or a shoulder? Did you find your results were lasting longer? Were they much more well?
Two parts of the story. When I started off in 1974, my practice, the area I live in was a mining area. So I'd get lots and lots of miners in who would get a bad knee from kneeling, the hacking away at coal, and they would get bad backs. And you wouldn't see them for a year. So you'd click them and you wouldn't see them for a year. There were strong men whose backs had gone out and manipulation really worked for them.
Yeah.
And what I noticed over the 10 years, people started to get weaker. And so your correction wouldn't hold as long.
Right.
So you needed to do more, so you need to understand more.
Yeah.
And as I understood that's what made me develop in 1989 some form of movement therapy that they could do at home to maintain it. And as we get weaker and weaker, we need much more help. So that people come in with a knee problem, but a knee to me is a victim of your foot and your pelvis being out of balance. So I would show them how to correct the footwear, change the footwear, how to sit better, how to develop different movements that help them in the house, and so it became more complete, and that made the corrections last longer, because you were teaching some sort of self-maintenance rather than I'll do the fixing, come to me next month or come to me next week to get rid of the acuteness. So really manipulation is very good for aligning joints. It didn't, what I found is it didn't satisfy for me the criteria of balancing the fascia and the ligaments and the energy channels, and so you've got to incorporate more into that, which is what the work of Dr. George Goodhart was doing.
Yeah.
He was putting all of these concepts into one place, but I wanted something that was more empowering the client that could do something at home.
Yeah. So something you've just mentioned there, fascia, which now a lot of research has gone into an understanding fascia and how it applies to the body and gives us our stability and shape. And there's obviously what we call now myofascial pathways that run in particular patterns around the body, help to give shape and support to the body. So do you want to talk a little bit more about how we work with fascia, or how you came into to learn about that?
Basically, again, studying the work of Dr. Stephen Levin over 25 years ago, and realising the body was suspensory rather than weight-bearing, and ligaments also had an intelligence. Now, 20 years ago, they couldn't measure any neurological activity in a ligament or any vascular. So they thought it had no blood supply and no nerve supply. Then years later, the instrumentation improved. And it was the same with fascia. Because they couldn't get any electrical feedback from it, they just thought it was tissue that connected us. It had no importance. Now we realise it's probably the most important tissue, because messages pass through fascia instantaneously, which is faster than nerves.
Right.
So a nerve gets an impulse and sends a message to the brain. So that's called a sensory input. It then responds to that with a motor output. So in other words, if you stood on something hot, the sensory input says, get off, and the reflex takes you off. So that's how the body works. Now, when fascia is distorted or strained, again through one-sided sports or sitting incorrectly,
Injuries,
anything that distorts the fascia, it dehydrates and the neurology doesn't transmit instantly. So when we go to make a movement, the whole body responds. We don't get up using our glute muscles. We don't get up from pressing from the floor. The whole body moves as one. And the fascia is basically globally connected and knows where we should be. So there's a system, a neurology system called the autonomic system, that makes us walk around and move around in space without having to think. When you have an injury, you're leaning on a crutch, your muscles aren't working properly, so that's not the autonomic system. You're using your fight or flight muscular sort of adaptation system. And fascia is, the more you can get fascia to work with you and the more you can free fascia off with your movements, the much better developed you are neurologically and posturally into an advanced stage.
Yeah, absolutely. And also the understanding of the facial pathways, in between the facial pathways is where the nerves, arteries, lymphatic meridian channels actually run.
So what fascia is basically, if you can imagine a plastic sort of wrapping around a muscle. So you've got lots of muscles in your forearm, you've got lots of muscles in your body, and each one is individually wrapped with like cling film. And it's watertight, it's to stop infection, it's basically to protect the body. So the only place that the nerves and the energy channels can run is actually in between those. Mm-hmm. So when a muscle becomes distorted or strained, it can block the energy. So say in the wrist, there's energy pathways coming from each of the fingers and the thumb, all coming through the wrist. Now you could have a repetitive strain on a wrist that can block all of those energies that could affect remotely different organs.
Yeah.
This one could affect the sexual organs. This one could affect the large intestine. This one could affect the thyroid. This one can affect the small intestine or heart. This one can affect the lungs, because they're connected to that.
Yeah.
So a repetitive strain here can cause remote problems. And that's something, again, we need to understand the globality of the body. Yeah. And fascia restrictions can cause a lot of problems. And it's very easy to work with. Now we understand and can measure it. The pandiculation type of exercise that I'm showing restores the balance of fascia very, very quickly, as it always did and as still does in animals.
Yeah. It's quite interesting, Dan, that you're saying that, because a lot of clients maybe present, for example, something common such as plantar fasciitis. They might also complain of a digestive disruption. They might also complain of a shoulder problem on the opposite side of the body, for example. And what's sad is when they come in, they've been in different places and they're all getting treated independently, as if they're all non-related. You know, they might put an insole for the foot. They might medicate a tablet for the indigestion, for example. But no one seems to be connecting these points together. I think what's great about active balance is we're educating all these fundamentals, but making people aware how each system can have an impact on the next system.
Absolutely.
Even if you don't understand that potential, that link.
Yeah. Even the foot, as you said earlier, I think the foot's the most abused part of our body. We wear wrongly fitting shoes. We wear them for too long. Inside of that shoe, we might be doing different things like driving all day. And at the end of the day, we don't go, oh, well, you've been working all day, I'll give you a nice workout. Yeah. And that can cause problems where your big toe doesn't move as well. So we can get problems of when we're walking, that can create imbalances in the pelvis. You've got points on the body that relate to organs, which reflexology is sort of enveloped as a totally separate system, but again, is part of the ancient wisdom thinking. And so those small distortions, micro traumas of walking, can cause lots of problems. And that can be causing your knee and your hip. But nerve entrapment, which is the nerves passing between all of the bones, has been proven from a few surgeons. Not a lot of research has been done. The best book I've got is way back from 1965, where two surgeons, Coppell and Thompson, found out that peripheral nerve entrapment, they call it peripheral nerve entrapment, could cause symptoms in different parts of the body. And until you free that off, you won't get results. So it's very easy to rebalance your foot, rebalance your fascia, and understand that most problems are quite remote from the actual site of the injury.
Yeah.
Quite interesting that then. So people shouldn't always be het up or worried about the thing that's necessarily painful. We should be thinking back, what could be causing this? Maybe look, for example, again, if we look at plantar fasciitis, should we use that as an alarm signal? It might necessarily indicate a foot problem.
Yes.
Should we think of something's wrong with the body as opposed to thinking we need to treat that area?
Why all of a sudden has it developed this inability for you to walk?
Yeah.
You know, what's different? When you trace it back, you did some sport or you had some injury you didn't get over. I worked on someone recently who'd broken a bone down in their ankle, and they had a snow boot on. They were told to wear that snow boot for 12 weeks, not to drive for 6 weeks. I phoned her up after several days. She said she was still in a lot of pain. She was taking painkillers. She was putting magnets on that I'd advised. And I went through and got rid of the pain in 5 minutes because she stopped the pain gate working, because it's no longer necessary for the brain to know about that. Yeah. So with some very gentle adjustments on a tissue, that pain went away, made her more mobile, able to walk without the boot and able to drive within 2 weeks. And so it's that understanding. Now she understands that, she's helping herself, but understanding a problem. She was in her late 60s, she has a few horses as a little homestead, and so it was very difficult to do all of those daily tasks.
Yeah, absolutely.
12 weeks is not a time frame she can afford to give up. But doesn't have to, because we've empowered her and treated her and give her some skills to do at home. To be able to manage it, so you can manage your own problems.
Yeah, and I think one of the important things is to understand for people is that when nerves pass through in between this tissue, the fascia, the nerve actually doesn't have much stretch at all. It has to be able to glide and slide past the tissue. So if we get a distortion from an injury or a repetitive strain, and we get dehydration on this fascia, it actually stops the nerve from gliding like it should, which is a lot of the time what causes the inflammation and the pain.
When I evaluate someone's foot, I want to know if the big toe is really flexible, and all the individual bones are also flexible as well, and the bone can move, the foot can move through various movements which are called inversion and inversion, so that the foot can walk properly. Now, if any of those are restricted, you're going to have problems. So if a person's got a really stiff toe, you've got the energy to the spleen on one side and the energy to the liver on the other. Yeah. So that again can cause imbalances to those organs.
Yes, yeah.
But when the toe's not working properly, that can put an entrapment onto the nerve that feeds up through the leg. Now that could give you sciatic type symptoms. It could give you symptoms on the opposite side of the body, and you might not even be aware of the stiffness until we evaluate it. Because the brain has to dramatize. In other words, it ignores. It has a way of switching things off. So old injuries don't hurt anymore, but still cause problems. What we do is we evaluate that. We check for nerve glide, because the nerves that feed in through there, they're in suspension in the tissue, and as the joint moves, the nerve glides. Whereas this muscle can stretch, and that fascia can stretch. The nerves glide. So as soon as you've got an imbalance in there and the nerve can't glide, you get nerve drag. And if you've got nerve drag, that's painful. So that's the biggest reason for your pain. And it's very easy to free that nerve off if you understand it. It's not that it's degenerated to the point that pain is a separate issue. And that fascia helps to rebalance that.
I think it's quite interesting because anyone watching, everybody suffers with some form of itis, whether it's plantar fasciitis, sinusitis, tendonitis, bursitis, even our organs such as pericarditis, but the key element is the minute we have inflammation, again, alarm bells should be ringing, the system isn't aligned, everything isn't working, so it could be a sewage system, a muscular system, a breathing system.
And see, inflammation isn't a bad thing. Inflammation is the body's response to the injury. But it's self-limiting, because once you've got the inflammatory things there to stop sepsis or stop infection or anything else, the body then is congested, it can't get them out. So you need to mobilise and free those areas off so that edema can go away, that inflammation can go away. So inflammation isn't a bad thing, it's a warning sign. And we need to take it as a warning sign, not to dogmatise it with drugs and let it get worse in our absence.
I think one of the big things as well for people to understand is that, because obviously when we do a treatment on someone, we treat the whole body, starting at the feet and working right up through. And when we're talking about specific conditions, it's not, if you're coming with plantar fasciitis, we're not only going to treat your foot, because it doesn't necessarily mean that it's coming from the foot. The pelvis could be out, the whole body's out of alignment in a sense. So we're going to treat the whole body as a whole, because that's what's causing that restriction on that one part.
As we said earlier, if your sacroiliac goes out of alignment, that's the biggest alarm signal to gravity.
Yeah.
So the body has to make adaptation straight away. So I've got plantar fasciitis on one foot and not the other. That in a sense should be a big message.
Yeah.
It wasn't there 2 months ago. It now is there. It's only on one foot. So we point out that you're walking out of balance and putting more pressure on there, causing an inflammatory response. If we change the alignment, it takes away the need for the inflammation, and the pain goes away. And people get that. Whereas if you use the alternative, you treat the symptoms and you're not looking at the cause. You've knocked the fire bell off the wall and the fire's still raging inside.
Yeah. I think I was going to say as well, just quickly there, Dennis, as well, and that makes real sense when you might have somebody come in from a car crash 20 years ago. They walk on a flat Industrial Revolution concrete pavement, but every footstep, unfortunately, is re-walking, re-patterning, and again, contributing to that misalignment and unwell-being of that person, isn't it?
And all traumas create what we call mental anchors. So the next time you see a crash maybe on the TV, you relate to that crash, you associate with it, and you've got to break those chains. And those chains that are mental images or pictures actually cause the muscles in that injury to maintain the spasm. So you could massage that out and it doesn't get rid of the mental part. It's really a body-mind approach. You really have to...
And that's what Chris said earlier as well. Most people, unfortunately, treat plantar fasciitis as a foot condition. Again, when somebody presents a facial condition, we don't just treat the fascia. We're always thinking when we work with a piece of tissue, we're tapping into every system in the body. We're treating the body globally. We're not just specifically treating a muscle independently or an organ independently. We're working with all the multi-layers of the body
even like you mentioned, you might have a foot problem, a digestive problem and a shoulder problem. And when you look at the body in that alignment system, you can see if there's a distortion there, it's going to put more pressure on one side of the joint. It's going to distort the shape of the abdomen and the rib cage where the organs live. So that could give you indigestion or that sort of thing. And then that's the whole body's basically affected. So that's the importance of looking at the body and treating it as a whole. Basically.
Because sometimes the adaptation become more problematic. The initial misalignment cause it.
It causes its own problems that eventually become a bigger problem than the actual cause, which was firstly just misalignment.
And that's why I always pinch the statement you said, Dennis, in the very first year when we learned is a short-term dis-ease will potentially long-term develop into a disease.
Yes.
Or a pattern or a root.
And that's all. Your joint is uneasy, so it's at dis-ease, but it's not diseased yet. But you leave an organ long enough not working properly, then infection gets in, or it lowers its immune response, or doesn't work properly, and that's how disease develops. It's nothing's a mystery. All your organs in your body move around in three-dimensional space. So as I'm breathing, my diaphragm drops, my lungs inflate in 3 dimensions. It gives much more room to my heart. My liver has to move out the way. Now, if I've had a whiplash and come to a sudden stop, the liver can come off its fulcrum, and therefore the diaphragm can't drop. So that could give me a breathing difficulty, which could then become asthma or a breathing difficulty, or I could take some infection into there. And that's not related to something that happened to me as a crash 10 years ago. We relate those things back and clear them out by getting rid of the cause.
Well, I had some great feedback last week. One of my clients, he's following the Active Balance book that we have. And what he realised when he was working with a foot condition, he thought it was a foot condition. He's also eradicated indigestion, a neck problem. He even used to get headaches frequently. And what he's realised now is a lot of those problems come from that point. But he wasn't treating the foot to get rid of those problems because he didn't have that awareness. So what's great is now he realises the choice of footwear. If he has to go to the shops with the wife on the weekend, if he has a headache on Monday, it's not a headache problem anymore. He knows it's down to his foot choice. Or if he's been driving his car for an hour, with his foot in a certain position, because that's, again, these are then parts of micro traumas that don't cause pain at the time, but they compound like interest.
But as we educate the client to that empowers them. They know they can't drive for 4 hours and get out of the car and be fine. You do a 10-minute routine and you recalibrate what we call the plasticity of that muscle being in one position for many hours. And that's what, again, the Active Balance program is showing you very simple techniques and procedures specifically to your particular lifestyle and plasticity that just maintain good neurology, good balance, good well-being.
And everyone's pattern's different because we all have different injuries, we all do different things, and that's why it's sort of the importance of learning about your own body, where your particular pattern is, and how to maintain it basically and look after yourself.
Absolutely. And that's what we want to make people curious enough to empower themselves to understand it. The body is self-corrective, and it's easy to give a little bit of time to balancing the body and getting rid of a whole host of symptoms
Yeah.
that plagued us before.
And I think what's great when you do follow the book and the protocol and the system, because it will be a system we have to do over days, weeks. It's not some, you know, some of these problems might be 30, 40-year-old, it could be from birth, it's congenital, but it's understanding throughout this time what parts of the lifestyle, whether it's lifestyle, choice, decision making you're doing, implicates these tensions. That book really helps find us, because it might sound a bit confusing at first if you're watching this.
Yeah.
If you've never done anything before touching the body, it might sound a bit complex, but when we've really got this book crunched down, so when you follow the system, it is very easy to find your own pattern, your own discovery, your own issues.
You know, and once you've found that pattern, you're then maintaining that pattern for the rest of your life, basically, because that's your distortion that you can look after.
Well, once you find out the client that big toe that wouldn't move was responsible for the knee condition and the hip condition and the headaches, then it's very easy for them to evaluate that toe wiggling. And also to find out what causes it to stiffen. So it could be driving, it could be gardening, it could be not doing enough kneeling, but all of that self-education is empowering them, and that's the whole purpose of it is. And the book is designed to be a course. You need to make a diary, because you will not. It says fix pain on the go. It does fix pain. It does get rid of inflammation. But the whole idea of it is as a concept is for you to teach the body over a period of time how to maintain itself, and it ends up being about 10 to 15 minutes, 2 or 3 times a week. Just checking various places, making sure they're mobile, making sure that there's no drag, making sure they're not painful when you rub them, and just keeping them well.
Just like you would do for anything else, really. You know, you think of tidying your house, you don't wait until it's really messy. Well, I do. But you tidy it as you go. You look after it as you go. The example you use, I know, you brush your teeth every day. You don't wait until they're dropping out and then go and get the
You don't go to work and go, oh, I better nip home. You know,
I have a neighbour who spends more time on his car. If he spent a fraction of that time on himself, that would be enough. And then they say they haven't got time. He'll wash his car and it'll take him 2 hours, and everything gets, you know, you're rubbing the bonnet and all of this with a cloth. What about what's underneath? And people say they haven't got the time. People need the discipline. And if there was no alternative to pain, if you couldn't take a painkiller, you'd fast get curious as to how to get rid of it. And it is so simple. You know, we don't use any pain medication at all, inflammatory marker pain, because we do these things on a regular basis.
And I think it's quite important then as well. A lot of therapists within the Active Balance team didn't originally start as therapists. Unfortunately, they had to go through all this different system of medication, failed operation, failed other therapies. And what's been great is when they've come to the dentist or another Active Balance therapist, they've found fundamentally how to look after themselves, and actually that empowered them to then become a practitioner. It could be somebody that you're already going to if you're watching this, somebody that you already know, but they've unfortunately get to this point via a structural problem or a pain. Well, you know, through that route that you've shown them.
And because of the system being really simplified now to alignment, basically the body follows the head, and so there's various things that we do to maintain the upright vertical ability of the body to move around in this 3-dimensional space. Because we've simplified that down, you don't need to take the same education because you're not treating symptoms, you're aligning the body, and the alignment actually is the therapy of the body. So it's much easier to learn, much easier to teach, and as we're working with someone, we find their pattern, and then it's much easier to go to the book and say, these are the points you need to do to maintain it, and that gives them empowerment as well.
So as well, for anyone looking to do the self-help treatment, we've got the book, we've got the website, we've got videos out there, but we're also training up people that we've got quite a few now around the country that you can actually go to if you log onto the website and actually be able to find the closest therapist to you to be able to go and get an alignment treatment.
And coaching from the book.
Yeah, absolutely.
Yeah, geographically we've got a big map now, and that's getting better all the time. Much more activity out there.
And we also have a community page on Facebook again, so any questions, any problems, any hubs, we've got a big community in there. You know, great following, get yourself there, and any discussions, we'll answer anything. We're there
to help. We're there to empower.
Brilliant. So
thanks for watching.
We'll see you soon.